Still to come on the programme, how specialised orthotic services answers the SOS call from people with severe disabilities with their tailor-made seating solutions. And we take a look at one of the very latest developments in wheelchair technology, the Nordigo system. But first, the Department of Health's Director General of Social Care talks to us about what the government is doing to improve care for everyone.
David Behan, let's start by talking about the government's putting people first agenda. How are its aims being made a reality?
Very important programme. The transformation of adult social care was absolutely essential in our view. People were getting access to good quality services, but people had higher expectations, they wanted more. So an agenda which puts people at the heart of care services, that gives people choice, gives people control and allows them to continue to live independently was essential, and that's what this programme is designed to do. And we're just about 12 months into this 3-year transformation programme, and every council now has a transformation team that's up and running, steering this change programme through. We've got 95,000 people who now use individual budgets and plans over the next 12 months to double that. So I think I'm delighted with the progress that we've been made, but we can't be complacent. It's a really important job as this, and we need to push on harder over the next 2 years of the reform programme, but great progress so far.
As you say, more work to do. So what do you see as the next steps in transforming care provision?
Well, I think one of the key issues is what we know we've got is buy-in from the most senior managers who are responsible for leading social care across the country. All 150 directors of adult services support this agenda. The challenge now is, can the million or so members of staff that work in this sector move forward with the same enthusiasm and the same commitment? So we've got a big job to ensure that we're inspiring and motivating those staff that work in this sector so they can work with the 2 million or so people that use adult social care every year in all their transactions, in all their relationships.
I want to talk now about a very shocking report into the deaths of 6 people in care. You know, something that the Ombudsman described as a situation that was an indictment of our society. I mean, what are you doing to improve healthcare for people with learning difficulties?
It was a shocking report, and of course when MENCAP published their report, Death by Indifference, the Secretary of State Patricia Hewitt then commissioned Sir Jonathan Michaels to carry out an independent review, and we published Value in People now in February of this year, and that was describing the next stage of the development of services for learning disability, and in there was our response, the government's response to Sir Jonathan's report, and we anticipated the Ombudsman's report as well. And some of the things that we're doing, every single person with a learning disability known to a local authority is now entitled to an annual health check from their GP. This was one of the big issues about there being no checks available for people with learning disabilities, and we're now in a position to put that right. We're also carrying out a confidential inquiry into all deaths of people with learning disabilities, and that was a commitment we gave to Sir Jonathan, and we made it again to Anne Abrams in her report. We're setting up what's called a public health observatory. And what these public health observatories do is it brings together the experts, mainly directors of public health, doctors, to look at the mortality figures and actually begin to make plans based on that evidence. So we've got an evidence-based approach. So there's some of the things that we were committed to doing, which are trying to put the policy and the services right, and also ensuring that we've got a very clear offer to people with learning disabilities to make sure we're picking up on their healthcare needs. And the last and most important thing in many respects is we're in discussion with the Royal Colleges and the universities and the training organisations to make all those training courses for doctors, nurses and social workers are running courses in how to communicate with people with learning disabilities.
Another major challenge you face, of course, is the ageing population and the growing need for social care provision. What are you doing now to prevent a potential crisis in the future?
Well, putting people first, which you've already asked about, is a key plank in the transformation of adult social care, and we think that that's essential to begin to respond to the future demand. And the key piece of work we're doing, and we're committed to do this, and the Chancellor in his budget statement announced that we would publish a green paper in June of this year, and it's in that green paper that we'll sketch out a vision for social care and support for the future, for future generations, and lay out what the various options are of how we can meet that need into the future. And we'll have a large-scale consultation over the summer of this year, which will hopefully build a consensus about not only why we need to change services, but how we need to change the services and what services in the future would look like.
David Behan, thank you very much for joining us.
Thank you.